Okay, let's get started. My name is Larry Zeng from Utah. Oh, I don't even know my university name. Utah Valley University. Okay, let's consider this scenario. I'm giving a poor image, low dose CT, FBP image. Now I need to fix it. Before I know it, the projection data have been deleted. The only thing I have is the image. What should I do? Find out poster number 1.
Hello, my name is Nele Blum from the University of Lübeck, and today I'd like to present you a method how we can reduce meta artifacts already in the projection domain by using conditional generative adversarial networks. So actually we use the projection data with the missing image information together with the corresponding binary mask as an input for the network, and then we train our network by using different networks which interact with each other. So we can train our network in an unsupervised way without using any ground truth data. So our projection data, which is then enhanced by the network, can use in any different reconstruction method that we can get also the enhanced data in the image domain. So on the right side, you can see here some results in the projection and in the image domain after and before and after the application of the network. If you are more interested in any details, please come to my poster presentation T2. Thank you.
The accuracy of CT value is of great significance in current CT angiography image processing. In this work, we modified the interpolation algorithm in special transformer network to improve the motion estimation accuracy and the CT value conservation. The proposed method has a good performance in motion artifact correction of 2D CT images.
I'm Emil Sidky from the University of Chicago. So this poster is about sparse view cone beam CT of bones. And instead of using exploiting gradient sparsity with the total variation norm, we're just doing plain voxel sparsity here. Thank you.
So hi, my name is Jed Pack. I'm from GE Research, and I'm presenting this poster on behalf of Isabelle Heukensfeldt Jansen, who did most of the work. But basically, I just want to tell you guys, I have a son who's learning how to drive. He's not an expert, so his results are a little variable. And when you do cardiac CT, if you're not an expert, your results can also be variable. We'd like to make it long-term so that you can just push a button, and then even my son, who learning how to drive, could do a cardiac CT. This is one step in that direction. We're trying to do a quick monitoring scan, take maybe one or a few projections per rotation, and determine when the contrast arrives and is approaching its peak, and also what the cardiac phase is, and so we can trigger the cardiac CT scan at the right time. Thank you.
Hi, I am Fatima. Today I'm going to present this poster on behalf of my colleague Hana. The arm CT liver perfusion imaging is needed during interventions in order to evaluate the success of performed embolization. Undersampled data due to limited number of projections and time pauses between rotations make it challenging to have accurate and CT-like perfusion maps. In this work, we use a model-based reconstruction technique and show the steps of extraction and inclusion of prior knowledge into the reconstruction. If you would like to know how, I invite you to visit my poster number 6.
To further improve the quality of low-dose CT reconstructions, we propose a hybrid neural network for low-dose CT denoising. The proposed network architecture consists of 2 blocks, the denoising CNN block and a training parameter-free optimization-based denoising block.
Dear all, our work is about the cerebral perfusion deconvolution while mixture of Gaussian model based on the nose properties. For the long accretion time and the contrast agent cause complex nose distribution in CPCT imaging. We use the mixture of Gaussian to model the noise distribution and the self-relative structure and similarity information as the prior to contrast the robust perfusion deconvolution model.
Hi, this is Wang from Stanford. Deep learning-based image denoising methods require high-quality images that are difficult to obtain in CT due to those concerns. The concept of noise-to-noise enables us to train the network using the noise-independent pair instead of a clean reference. However, it is uncommon to have a pair CT scans with independent noise. We propose a method to generate such pair data for usage in deep learning training from a single CT scan. For more details, please come to our poster T9.
Hi, yesterday we presented our first results at our dark field CT prototype system for clinical applications. And in this prototype, we face two main challenges when trying to process our data. So the first challenge is that we have a continuous acquisition, which makes face retrieval more complicated than usual. And the second challenge is that we have a lot of perturbations and vibrations in our system, which for an interferometric approach, of course, makes things pretty hard. So if you want to find out how we tackle these two problems and manage to improve our reconstructions from picture A to picture B, you can visit poster 10.
Hi, in this work, we propose a S2MS, a self-supervised learning-driven model spectroscopy image enhancement. We like to use this projection summation image as a target and to train a different image channel network to as a self-supervised learning to enhance images. So if you are interested in our poster, please step by number 11. Thank you.
Hi, I'm Choi from KAIST. At poster 12, we're presenting our feasibility study results in tackling metal artifacts in the sinogram domain. We trained our network with metal inclusive sinogram to a virtual non-metal inclusive sinogram without any metal segmentation. And hopefully you guys can visit poster 12 to discuss its further applications to clinical data. Thank you.
Hello everyone, I am Fang, a PhD student from Tsinghua University. In this work, we introduced our effort on the development of MEV dual energy CT system for container imaging. We proposed a new deep learning-based method for the effective atom number image calculation of the system. My number is T13. If you are interested, let's discuss more about it.
In this work, we proposed a ResWNet for dual energy combing CT imaging. 3 modules were designed for scatter correction, material decomposition, and decomposition denoising in projection domain. Both scatter correction and decomposition denoising applies conventional ResUNet, and the material decomposition module applies a polynomial connection between attenuation projection and a material composition projection. Simulation study demonstrate the performance of proposed method on scatter correction and no noise decomposition.
Hi. On my poster T15, you can see how we model vibrations in our Talbot-Lau interferometer on the first clinical entry, about which we have seen 2 talks yesterday. And we use principal compound analysis to find few dominant vibration modes, which enables us to do sample reconstructions without any movement artifacts. Hello, in this work, we like to explore a novel basis material decomposition method for long nodule character realization, and with this multi energy CT images. And we like to use this novel basis material to improve our diagnosis performance. If you are interested, please step by number 16. Thank you.
In this study, we investigate image reconstruction from limited angular range data in phase contrast CT. We first proposed a unified image model for both gradient-based and propagation-based phase contrast CT, and then we formulate a optimization problem containing images directional total variation constraints, and then use a DTV algorithm to solve it. We also designed two different scan configurations. One contains only a single arc, and the other contains two orthogonal arcs. Results show that the DTV algorithm can reduce the limited angular range artifacts significantly, and also the two orthogonal arc configuration can further improve the reconstruction accuracy. So for more details, welcome to T17. Thank you.
Hello, this is Zhongxing from Mayo Clinic. So we developed a self-chain deep CN for noise reduction in CT. So this model is chained using the case itself and didn't need additional cases. And we apply the inference on this case itself. We adopt the extensive data augmentation through the projection domain. And we conclude that we can get similar or even better image quality compared to the conventional deep CN denoising method. Our poster is 18. Thank you.
And this is a video of my poster called 2D 3D motion registration for rigid objects within a soft tissue structure. I can come to my poster number 19 during the Tuesday poster session. I can share with you how we've created our dynamic phantoms, how we acquired our data, how we pre-processed it, and of course our 2D 3D registration results. I'll talk to you soon.
Okay, yeah, so my name is Xuan from UC Southwest Medical Center. So this work deals with a clinical problem. In our department, we have ESOs, which essentially rely on community for online adaptive retina therapy. But for abdominal region, because this gas bubble can move kind of unpredictably and also non-periodically, and it creates kind of lots of artifacts on common CT. So we applied some of our previous work called simultaneous motion estimation and image reconstruction technique to try to tackle this problem. Essentially, it kind of estimate the motion from this grouped projections, and then do motion compensated image reconstruction. We found it's kind of like shows some promise, but I don't think we solved the problem yet. So if we are interested to know what kind of challenges we're still facing, you are welcome to stop by at T20. Thank you.
Hi, I'm Alex Sietsema. I'm from Michigan State University. So for our work, we were thinking about the fact that in a lot of models with scatter, people treat scatter correction as just one pre-processing step before performing a reconstruction. What we're interested in is what happens if you perform the scatter correction and the reconstruction together at the same time as part of one more complicated optimization. So our study here is in a kind of a simple setting for CT. We're looking at how these two methods compare. Thank you.
Hi, my name is Ben Rizzo. I'm from Marquette University and the Medical College of Wisconsin. And I will be presenting work that we've been doing, extending the constrained one-step spectral CT reconstruction method to reconstruct dual energy data. And in the poster, I'll be specifically investigating that using inverse crime and an experimental study. Thanks.
Hi, my name is Kai. I'm from University of Pennsylvania. Here today, I'm going to present our project in 3D printing. Basically, we can print any CT images into phantoms like this. And when you scan this in your CT scanner, it will get exactly the same CT images as the patients. It is pretty cool because I think we are like no one can do as good as resolution as us, and we can do any type of 3D printers from any brand, and we can do like soft tissue for small bones. And you can also see here, we can follow exactly the same Haeusele units. So if you think we can help some of your projects or or just interested in 3D printing, you can find me. We can talk about it. Thanks.
I am Quinn Ma, the Master of Slides. So for the past couple of years, we've been trying to get non-circular trajectories onto clinical robotic C-arms, and we got some really fantastic results. We also recognize the great importance of the workflow for the eventual clinical adoption. So we've been making improvements in all the aspects in like processing time, calibration, etc. So if you want to know the nitty-gritties, please come to my poster at T24. And please send me your slides for tomorrow by tonight. Thank you.
Hello everyone. I'm Mengzhou Li from Rensselaer Polytechnic Institute, and our work here is about motion correction for photon counting CT. And as mentioned earlier in earlier talks in this morning, photon counting CT enables high resolution imaging. But as we know, high resolution imaging is also more sensitive to the motions of patients. So here are the main results of our work. And in the figure, the high resolution reconstruction of the human wrist before and after correction are shown here. And in the figures, from the figures, we can see that many subtle bony structures previously hidden under the motion blurring and artifacts are revealed with our method. So if you are interested in more details, welcome to T25. Thank you.